Still ahead here. Hi, everyone. I'm Tess. You've heard how postpartum and pregnancy can affect moms, but what about babies? We're going to take a closer look at this with Dr. Thompson when we come back.
In your Health Watch this morning, expecting a baby is a time full of emotion for new parents, excitement, maybe nerves, fear of so many changes to come, and just anticipation to meet your little one, hoping for everything to go well and have a healthy baby. But Tess, all of that anticipation really to the body feels like a lot of stress, right?
Oh, yeah. So many hormones alone going right. But we're talking about this new study because it's saying depression and anxiety during pregnancy and even after childbirth could also harm childhood development. We want to bring in Dr. Sharon Thompson this morning to expand on this. Dr. Thompson, good morning.
Good morning. This is such a critical topic because lots of Americans are dealing with mental health issues. And I appreciate the lead-in where you were talking about some of the anticipation about having a new baby and starting a new family. And it's not that kind of worry that we're talking about here. We're talking about more serious symptoms where women will really have symptoms of clinical depression, like sleep disturbances and appetite disturbances, lack of interest in things that they used to be interested in, sad mood, tearful all the time. So we're talking about clinical symptoms here. And we've known for decades that when women are symptomatic in terms of their mental health, it can affect development of the fetus in utero. Babies tend to be small if moms are symptomatic, and it can affect babies after birth. And this study reinforces that. This study pulled together all the studies that looked at these two variables and found that there is an association between maternal significant mental health issues and childhood development.
So this study, I know, looked at this, but really pointing out the association, did they talk about a cause, a direct cause of why this happens?
That's such an excellent question because an association is not a cause, right? There could be another third factor that causes moms to have these symptoms and affects fetal development. So we don't know cause, we just know they are associated. And what we do as standard of care in obstetrics is recommend that when moms are symptomatic, they consider treatment. Treatment could be talk therapy, therapy called cognitive behavioral therapy can be very helpful, or medications if they need it. But definitely the treatment is far better for mom and for baby than going untreated.
Can you talk about the difference in symptoms? We talk about the normal anxiety over having a child, pretty normal, but when is it problematic? When is it that you probably do need some extra help?
Yeah, so thinking about your baby a lot obviously is normal. Worrying about, will you be a good parent? Completely normal. Everyone thinks they're going to kill their baby, right?
Sure.
Every single new mom, and that's normal. But if those thoughts don't go away, so you have a thought fleeting, you chuckle a little bit and move on, that's normal. If you're crying every day because you're so anxious and worried, or if you fear taking care of the baby because you're so worried you're going to hurt the baby, or if you're not able to sleep at all. Obviously, new babies will keep moms up, but if you're not sleeping at all, you lay down, fall asleep, and you're popped back up, and that goes on for night after night after night, this is a problem. You know, if your family members notice that you're constantly crying, this is a problem. So we need families too to really be keeping a close eye on pregnant women and on moms. So because sometimes a woman herself won't be able to identify that something's going on, and she needs that loved one to really be paying attention to her.
Or maybe sometimes even being in denial. So it is everyone's job, of course, to make sure moms and babies are all healthy. Dr. Sharon Thompson, we always appreciate your time. Thank you so much.
Thank you.